Did you know if you're on a Part C Medicare Advantage plan, you could be on the hook for up to $600 per night in the hospital? But no worries, this $25 monthly plan will pay all of that for you. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm telling you guys how we have saved our clients thousands of dollars by adding on a simple side plan to their Medicare Advantage. And I'm going to go over three real basic topics. So number one, I'm going to tell you some of the major exposures that you're going to find on a Part C Advantage plan. Number two, I'm going to tell you exactly how we've helped our clients cover those gaps. And then lastly, I'm going to tell you exactly how much these types of plans would cost if you want to cover those major exposures. And that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this information helpful. I really appreciate you doing that. Okay, so what major exposures are left behind by Part C Advantage plans? Well, for starters, I want to say that Medicare Advantage plans are really good. The satisfaction rate on Part C Advantage plans is over 96% according to Forbes, and currently more than 2 to 1 people do Medicare Advantage than they do Medicare Supplement. Now, with all those facts being true, there still are some exposures that are left behind by Part C plans. So the first exposure that you need to be aware of is your hospital copay on an Advantage plan. Now, all Advantage plans are unique, so I could only give you general examples, but every Advantage plan I've ever seen charges you a per day copay when you're at the hospital. And plans can charge the first 4 days, the first 5 days, the first 6, even the first 7 days of hospitalization. And then after that period, okay, your days at the hospital are a zero copay. But what we see in Ohio and our bordering states is plans are generally charging $300 to $400 per day at the hospital, and then they're charging either 5, 6, or 7 days of inpatient admission. So if you were on a Part C Advantage plan that charged you $350 a night at the hospital and you spent a week in the hospital, you could be on the hook for $1,750 because that plan would charge you $350 a night times the first 5 nights, which would be $1,750. Okay, so the second major exposure that you're going to have on a Part C plan is if you have to get cancer treatment in an outpatient center. So there might be exceptions to this rule, but every Advantage plan I have ever seen charges 20% coinsurance for chemotherapy and for radiation. So in essence, you are going to be billed 20% of the plan's negotiated amount for that chemotherapy or radiation. And that's for each treatment. So people that go through cancer treatments are likely to hit their maximum out of pocket on the Advantage plan. So if your Medicare Advantage plan sets a ceiling, otherwise known as a max out of pocket of $5,000, if you're doing chemo or radiation, it is very likely that you're going to owe $5,000 that calendar year as your out of pocket costs, because 20% of chemo or radiation certainly is going to hit at least $5,000. So if your ceiling was 5, you would be charged the $5,000. Your spending would stop, but you would still owe $5,000 in bills in that calendar year. Okay, so the third area you're going to see a major exposure on a Medicare Advantage plan is going to be for skilled nursing care. So almost every Advantage plan I've ever looked at, it'll give you your first 20 days of skilled nursing paid in full. And then on day 21, that's when the copay kicks in. So most plans charge between $200 to $250 a day once you hit day 21. So imagine you had to go for skilled nursing and you were there 30 days. Well, if you were responsible for days 21 through 30 and that was billed at $200 a day, you would get hit with a $2,000 charge. $200 per day times the 10 days that you were responsible for. Because again, days 1 through 20 were paid by the insurer, but you would have to pay days 21 through 30. You would have about a $2,000 responsibility when you came out of the nursing facility. So those are what I call the big three exposures when it comes to Medicare Advantage plans. Again, you're going to have inpatient hospital stay is a major exposure, cancer treatment in an outpatient center because it's billed at 20%, and then skilled nursing or rehab, once you get past day 20, that's going to add up pretty fast as well. So what do we do at LMS Insurance Group to protect our clients who are on Part C Advantage plans? Well, we strongly encourage anybody we meet with that's on a Part C Advantage plan to consider picking up a Hospital Indemnity Plan. So the word indemnity is defined as security or protection against a loss or a financial burden. And that's exactly what hospital indemnity plans do. They protect that financial loss or that burden that I discussed in the previous section. So hospital indemnity plans are customizable. You are able to add riders to the plan and different benefits that are going to cover those exposures we just discussed. Okay, so generally when you buy a hospital indemnity plan, it's going to be based on your age. So the younger you buy your hospital indemnity plan, the better the price is going to be. And the plans that we sell at LMS, your price is locked in. So whatever you pay at age 65 is exactly the same that you would pay at 75 if you continued to carry that policy. Now we offer these plans with 5 or 6 different insurers, but we have definitely found our favorites in terms of who's the best on price and who pays their claims the fastest. Now it's important to note that you can't just buy this plan when you think you're going to be in the hospital. You have to have this plan in place because most of these policies have a 6-month pre-existing condition clause because they are trying to avoid you buying it because you have a surgery scheduled and then dropping it afterwards. So if this is something that you think would help you, it is something that you want to have in place regardless of if you need it today or not. But the general idea is you have a separate plan that goes on the side of your Advantage plan, and it is going to pay you dollar for dollar if those losses occur. So if you have a hospital stay and you owe $350 a day, the hospital indemnity plan is going to write you a check for $350 per day. So how much do these plans actually cost? Well, that's all going to be determined on your age and where you live. Now remember, these plans are customizable. So you can buy a hospital indemnity plan that just covers your hospital stay for you. You can buy a hospital indemnity plan that covers hospital and skilled nursing. Or you could buy a hospital indemnity that would pay you for a cancer diagnosis and that also covers nursing and hospital. But of course, the more benefits you add, the more exposures you cover, the larger the monthly price is going to be. Okay, so let's look at some real examples. So if you are a 65-year-old female in Ohio and you purchased a hospital indemnity plan that paid you $350 per day for the first 5 days of hospitalization, that plan would cost you under $25 a month, as you could see on the screen. So again, you want to pair this or match it with what your Advantage plan charges. So if your Advantage plan was charging $400 a day, then we would set the benefit to pay $400 a day. But we're assuming in this example that your Advantage plan charges $350 per day the first 5 days. So if we sold you a hospital indemnity plan that would cover the first 5 days at $350 a day, that would cost you under $25 per month. Now, maybe cancer is something that runs in your family, or it's just something that you want to insure against. So in this example, we added a $5,000 cancer rider. So the idea is, if you had to go through chemotherapy or radiation, you would hit your max out of pocket. And let's say, because an average max out of pocket is about $4,800, let's say your max out of pocket was $5,000, meaning you cannot be charged more than $5,000 in the calendar year. So under this example, we have a hospital indemnity benefit that's paying you $350 a day the first 5 days, but we also added in a cancer rider that would pay you a lump sum $5,000 if you were diagnosed with cancer. So in this example, for a 65-year-old female, that would be $39.66 per month, and now you would have covered the two largest exposures in a Medicare Advantage plan. Okay, for our third example, I'm going to show you how much it would cost if you wanted to cover those first 5 days of hospital, but you also want to cover days 21 through 100 at skilled nursing. So when we add those two benefits together for a 65-year-old female in Ohio, you're looking at $36.31 a month, and you would have nursing home and hospital covered in full. Okay, now for our last example, let's say that you are very risk adverse. You don't want any risk. So you want to cover the hospital, you want to cover the days 21 through 100 at the nursing home, and you also want to have that cancer benefit built in. Well, if you did that, you added all three of those benefits, a 65-year-old female in Ohio, we could get you that coverage for $51.43 a month. So in that scenario, you have covered the three largest exposures on your Medicare Advantage plan, all for around $50 per month. The idea here is I just want to give you examples of what you can do with a hospital indemnity plan. They are incredibly versatile, and you can add all the riders I just described, plus there's other things you could add to the plan if you wanted. So guys, to conclude, Medicare Advantage plans are rising in popularity as now 54% of beneficiaries have Part C plans. And although these plans are very good and we certainly recommend, they do leave certain exposures behind. And for as little as $25 to $30 a month, you are able to reduce your exposure and reduce your risk on Medicare Advantage. So if you want exact prices for your age or your location, use the information on the screen, as me or somebody in my office would love to help. Guys, I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group. Thanks.